Great, thanks, Gil. And I just wanted to emphasize that the website is now updated. So if you go to crohnsandcolitis.ca/COVID-19, and sorry if I'm looking away, I'm looking at my other screen here, you'll see the updated website. And if you go to guidance, assuming my internet works, it's loading. Website, I think we sent too many people to the website all at once. I think that's what just happened. So you'll see that further down in the guidance section, there's reopening of schools and the economy, and you can learn more and read the recommendations here for yourself. But I'm going to show you sort of briefly what we're recommending for people with IBD in terms of the reopening and the going back to school. I think it's good news, grand reopening of everything, but it's not that good news, right? In Canada, we're doing this slowly. We're doing this very, very cautiously. And so it's not that everything is going to open up all of a sudden. We're paying very, very close attention, as are the public health officers and all the politicians, to monitor to make sure that we don't get a second spike. I think we're expecting that this virus is not going to go away for the next few years, at least until we get a vaccine, and that a low simmer. I think Dr. Wilson said this at one point during the webinar a few weeks ago. A low simmer is what we're aiming for as people gradually get immunity, and perhaps exposing the people who are at lowest risk for dying from COVID-19, and gradually get immunity and not let it get to a boil again, right? Not let it spike up and affect our healthcare system. But we are slowly reopening, so we felt like we needed to make some new recommendations so that you could understand what we feel should be done. So just a disclaimer, again, it's always based on the latest available evidence. We just don't know what's going to come out in the future, what risk factors might be there. We're still being very prudent and very cautious, and we're trying to protect you and your family members who have IBD as much as possible, while allowing you some freedom to re-engage in life. And these recommendations don't replace the recommendations of your local public health agency or your doctor. So speak to your doctor if you have any questions. And then finally, we made age-based recommendations this time, because I think school, work, young versus old, things are quite different depending on what age we're talking about. So I'll go through some of the age groups overall. So firstly, to start, this is a pediatric webinar, so we're going to start with children and teens under the age of 20. As Gil mentioned, children and teens have very, very mild symptoms. They are very unlikely to be hospitalized. In Canada, so far, only about 2% were hospitalized, and less than 1% had to be admitted to the ICU. In the Secure IBD registry, there were, at the time, last week, I guess, there were 31 patients. Now there's a few more, but of the 31 patients, 3 were on systemic steroids. Remembering that steroids are a medicine, that's the one medicine that we're a little bit concerned about in IBD, that steroids may be associated with worse outcomes for COVID-19. But for all the 31 patients who were under the age of 20, there were no deaths and no ICU admissions, even if they were on steroids. There were more patients under the age of 30, so that 20 to 30-year-old age group, there were quite a few more, and more were on steroids, and they all did well as well. So even the young patients on steroids seemed to do okay. The patients who were on immunosuppressive medications and biologics all did very well. Nobody needed to be hospitalized if they were in the childhood group. And so in general, it seems like COVID-19 may be equivalent in terms of risk for pediatric patients to the seasonal flu, and in fact, maybe a bit safer. I think more people die seasonally, more children die seasonally from the flu than so far in Canada have died from COVID-19. It's early days. I'm being cautious. I'd be curious to see what Dr. Allen says about that during his presentation. But in general, we go out and we engage in society with the seasonal flu, even when unfortunately most people don't get their flu shot, even though you should get your flu shot. Most people don't. So we're not scared of the flu for children. I think the message would be the same for COVID-19. This is another really positive message that came out of New South Wales, Australia, and this was looking at before the closures in Australia. They tracked actually the number of infections in public schools in Australia, and there were actually 18 infected individuals in public schools. 9 were students and 9 were staff members who were in close contact in those schools to 735 students and 128 staff members. Of all of those people that they were in close contact with, no teacher or staff member got COVID-19, and only 2 children of the 735 students exposed got COVID-19 after that. So you can see that with the the little dots. These are all the exposed people, and here's one person in this place in the school that got COVID-19, and there was one other person in there as well. So a very small number of people, a very small number of children are getting COVID-19 in schools after being exposed to COVID-19 in their colleagues or their staff members. That's important because one of the major concerns that we had about COVID-19 in children is that children might be super spreaders. And what a super spreader is, remember that Gil spoke about the R0 number a little bit earlier. A super spreader is somebody that might have an R0 of 9 or 10, so they might spread it to 10 other people. And the reason we were concerned about that in children is because children have very mild or no symptoms, and we now know that COVID-19 can be spread even if you're asymptomatic. So, we were concerned that there's all these mild children out there that are spreading it to a whole bunch of people, and if we reopen schools, it's going to be a major disaster. This New South Wales public health report says that's not the case. It's one report, so again, I urge caution. We don't know, and we're going to see going forward for sure. There have been a number of countries that have reopened schools in the past week or two. We'll know more very shortly, I think, but this is an encouraging report for sure. So in general, for children and teens, our recommendation are that it's safe to go back to school as long as you're following public health guidance. And what we recommend is that don't send your child back to school if your child is newly diagnosed, has severe active inflammation, is taking steroids, and the doses of prednisone are shown there, has moderate or severe malnutrition. Those would be times when you don't send your child to school. It's really the steroids and the active inflammation that we're most worried about. Moderate or severe malnutrition is rare, but it does happen in children at diagnosis. And then what we're recommending is that you try to shield your child if that's the case. And by shielding, what we mean is that all household members who live with your child should employ good hand hygiene and other strategies to reduce transmission of COVID-19, such as adhering to physical distancing and cleaning the house really well. And then where possible, household members should engage in physical distancing from your child, so maintaining a distance of at least 2 meters. We say where possible because that's obviously very hard with siblings, to do. And if it's a young child, we understand the concerns about doing that. But if possible, especially if somebody else in the household has been exposed to COVID-19 at school or at work, please stay away from the child who is sick, essentially. Household members should adhere to public health and physical distancing recommendations outside of their home, like of trying to avoid in-person meetings, modifying their work duties to allow for physical distancing, using services for vulnerable people like the early opening work hours, early opening pharmacy and grocery store hours, and clean the residence as best as possible. And what we're recommending is that you wait until your child is feeling better and has tapered down on the prednisone to below 0.5 milligrams per kilogram per day. And this may take some time. So, by the time remission is induced and the child is feeling better and the inflammation has gone away, is not a matter of days after starting a medicine. It could be a matter of weeks or even months. And so please take your time in sending a sick child back to school. Speak to your doctor before doing so. For the other recommendations for children is essentially if there's an outbreak of COVID-19 in your child's school, keep them home from school for at least 14 days and speak to your local public health office for recommendations and further instructions. And if your child has other illnesses, other things that might put them at risk for severe COVID-19, speak to your doctor about that before sending them to the school. So don't forget that it's not just about the IBD. We know that people who have respiratory illnesses, cardiac illnesses, diabetes may be at risk for severe COVID-19. So please speak to your child's doctors before sending your child to school. So adults aged 20 to 64, again, the bottom line is from the Secure IBD Registry, we know that they generally do very well, even if they're on immunosuppressives and biologics. So we've recommended that if you're healthy and in remission, follow your local public health guidance. But if your local public health office is saying you can gradually start to go back to work, we're happy with you gradually going back to work, even if you're on an immunosuppressive medication or a biologic. The exception, again, is steroids and severe active inflammation. So if you're in the middle of a flare, if your doctor has told you you have moderate or severe active inflammation, if you're on steroids more than 20 milligrams per day of prednisone, if your doctor has told you you're malnourished or you're underweight, or if you're on TPN, intravenous nutrition through a central line, please stay home. If you have other comorbidities that put you at increased risk for severe COVID-19, as I mentioned, you should also consider staying home. And then finally, seniors is a little bit more difficult because we know this is the group that is most at risk for severe COVID-19 and death, and that the risk increases with age. So remember, it's not a sudden at 65 or at 60, you're at more risk. This is a gradual thing, right? So a 60-year-old is at lower risk than an 85-year-old, and a 50-year-old is probably at greater risk than a 40 or a 30-year-old. But it's a continuum, and you have to consider all of that when you're making your decisions about whether or not to go out. So we recommend for seniors to take a more cautious approach and consider your risk factors carefully. Consider what what you want to tolerate in terms of your risk, and also consider continuing self-isolation. Again, if you're on prednisone, severe active inflammation, if you're malnourished, or if you have other comorbidities. In general, for seniors, we recommend speaking to your doctor before making any decisions and getting their recommendations. And remember, what we know is changing very quickly, and these recommendations should supplement but not replace the recommendations made by your doctor or your local public health authority.